Today we'll be talking about hyperosmolar, hyperglycemic, nonketotic syndrome. First, let me define it for you. This syndrome includes number one, severe dehydration, number two, hyperglycemia, number three, hyperosmolarity, and number four, decreased mental status. Acidosis is usually not present. We'll begin with a case. This is an 80-year-old man with a history of type 2 diabetes. He was brought to the emergency department by EMS. The family, who called EMS, states that he was unresponsive. When EMS arrived, he was altered mentally. His vitals were in normal range, but his finger stick was unreadable, which means it was very high. On arrival to the emergency department, the finger stick was also performed, which showed a glucose level of over 1,000. This is not a difficult case to diagnose, but the management has to be quick and accurate. An external jugular line was inserted, blood drawn, and 1 liter of normal saline bolused. Vitals showed a blood pressure of 109/60, a heart rate of 115, respiratory rate of 20, temperature of 99, and O2 sat 96 on room air. On physical examination, there were no signs of trauma, and the patient is still mentally altered. The labs came back very quickly. It is as follows. His glucose was over 1,000 milligrams per DL. The BUN 35, the creatinine 1.2, his potassium was 2.9, the osmolarity was 420, the anion gap was 10, the bicarb was 21. His blood gas was normal and urinalysis and urine osmolarity pending. His labs showed significant dehydration. His osmolarity indicates a concentrated serum. BUN is elevated with normal creatinine and he is tachycardic. All signs of dehydration. His urine, on the other hand, will be very diluted. Dehydration is a very serious condition and can interfere with normal physiologic function. He's on the cardiac monitor with pulse oximeter and oxygen. The ECG showed normal sinus rhythm and the chest x-ray was normal. He's about to get a 2nd liter of normal saline and a Foley catheter inserted. The history of a person with hyperglycemic, hyperosmolar, nonketotic state usually include the following. Number one, polyuria. Number two, polydipsia. Number three, weight loss. Number four, dizziness. Number five, weakness. And number six, sometimes confusion. The physical examination will always have findings indicating dehydration, such as number one, orthostatic hypertension, number two, dry mucous membrane, number three, poor skin turgor, number four, collapsed neck veins, and number five, tachycardia. An insulin drip was started and his glucose level is being monitored closely. Usually, fluid alone can correct this condition, and some patients' glucose seems to drop very rapidly with insulin. In this patient, the moment his glucose reaches 250 milligrams per DL, I will switch the fluid to D5 normal saline and stop the insulin. His potassium was also replaced. Caution has to be used when administering insulin to these patients because it can worsen hypokalemia. This patient did very well. He received appropriate fluid resuscitation, potassium replacement, and insulin. His glucose came down significantly and he was much more alert. The disposition for this patient is to admit to the ICU. So let me summarize this for you. Number one, hyperosmolar, hyperglycemic, nonketotic syndrome causes significant dehydration, which can result in altered mental status and other physiologic dysfunction. Number two, fluid resuscitation should start immediately and follow up with an insulin drip. Number three, labs ordered should include complete metabolic profile, the CBC, PT-PTT, cardiac enzymes, serum osmolarity, urinalysis and urine osmolarity, amylase, lipase, and toxicology. Number four, the ECG and the chest x-ray should be ordered. Number five, the patient should be placed on cardiac monitor with pulse oximeter and oxygen. Number six, a good physical examination should be performed, looking for neurologic deficits and also signs of trauma. And number seven, the patient should be admitted to the ICU. Well, this brings us to the end of our review of hyperosmolar, hyperglycemic, nonketotic syndrome. I hope this short review was very useful and productive for you. Thanks for watching, and I wish you well. Good night.